Guahan, Linda and Pinko Denorsi, Director of Public Health and Social Services, and Dr. Ricky Hernandez, Deputy Administrator of the Guam Economic Development Authority. And now to Governor Leon Guerrero for her opening remarks.
Thank you, Janella. Half a day and good afternoon. As of today, we have 170 confirmed cases of COVID-19 with 5 deaths. 143 of the 170 has been released from isolation, and there are 22 active cases. Last night's newly confirmed cases have been identified as close contacts of previous COVID-19 cases. This means transmission is not as widespread as it was earlier in the pandemic, and contact tracing is working to identify these cases. As I have said before, reopening Guam won't be like flipping a light switch. It would be like watching the sunrise. It will be slower than any of us wants. It will be measured, and it will be careful. Every decision made is based on the data we have and our ability to manage the threat of COVID-19. After meeting with the Physician Advisory Group and Economic Advisory Group, I am announcing further relaxation of restrictions during our PCOR 2 and the conditional reopening of Guam's tourism markets from South Korea, Japan, and Taiwan effective July 1st. Additional businesses that can operate under PCOR 2. Effective Friday, May 29th at 8 o'clock a.m., the following establishments are permitted to operate. Dine-in restaurants, with the exception of food courts, bars, and taverns. And they have to be in accordance with the minimum requirements for dine-in restaurants memo issued by Public Health. And these are, they may operate at no more than the % of occupancy rate as defined in current or future executive orders. Current executive order states occupancy rate as of now is 50% or less. We are also relaxing restrictions on places of worship at no more than the % of occupancy rate as identified in current or future executive orders, and face coverings, masks, are required to be worn at all times. While we understand the role worship plays in many of our lives, we ask vulnerable individuals, such as the elderly and those with comorbidities and or are immunocompromised, to stay home or take extra precautions. Nonprofit organizations are allowed. Private fiscal activities, exercise lessons at limited occupancy level. These are, for example, your CrossFit, your yoga, your Pilates, and dance. This lifting of restriction does not include gyms. Pending an executive order, public parks and beaches will open. However, people still must follow the social gathering mandate as prescribed in our Executive Order 2020-14. Social gatherings of up to 25 people will be allowed. When we go and talk about our tourism industry has taken one of the biggest hits because of COVID-19, not just on Guam, but throughout the world. Tourism represents 60% of our island's economy, and 1/3 of private sector jobs are directly or indirectly related to tourism. Therefore, pending an executive order, I will be conditionally relaxing restrictions of entry into Guam for these markets that will open up for South Korea, Taiwan, and Japan effective July 1st. These markets, South Korea, Taiwan, and Japan, represent low risk of COVID exposure from these countries. Japan removed their health emergency earlier this week. South Korea has been able to contain further transmission, and Korean Airlines will begin flights in June and has been. Taiwan has led one of the best responses to COVID-19. Mandatory quarantine will still remain for high-risk countries such as the Philippines. If at any point we see continued increase in the number of cases, I will not hesitate to re-implement social isolation measures. I will not jeopardize human life or risk an even longer period of recovery. Public health continues their expanded target testing. Testing is currently ongoing for the homeless population, and we've tested vulnerable groups like the elderly and those living in public housing. We encourage anybody who displays potential symptoms of COVID-19 to see their healthcare provider, and public health can only test the samples they receive. I'd like to turn it over now to Linda to give us an update on the COVID status.
Thank you, Governor. As of yesterday, we conducted 64 tests. This is specifically just for those that were done at the Department of Public Health. We were mindful that there are other tests that are conducted, like at the Naval Hospital and also at DLS and GMH. So the data I'm giving you is specifically for the department, 64 tests, and 2 were positive and 62 were negative. And the 2 that were positive have been identified to be contacts of the 11 positive cases that we announced previously. We are still ongoing all the investigation into the household and close contacts of these 11 positive residential clusters. And as we journey through, we are going to be testing, and we continue to test them to ensure that all of them have been adequately tested. As far as the total number of cases of testing that we've done from March 12, 2020 to the present May 26, which is yesterday, we had 3,199. And again, these tests are continuing. We currently have about 5,052 test kits that are remaining, and we want to reemphasize that we have an increase in our COVID cases, as the governor had indicated earlier. It is now at 170. And just to give you a breakdown, other than the Department of Public Health data, the laboratory testing that was conducted also at GMH amounts to 717. The one at DLS, our diagnostic laboratory services that we do have a procurement with, is 839 tests that were done. GRMC has completed 98 tests altogether. The Guam National Guard, 17 tests, and the Department of Defense, 1,065 tests. So as you can see, these are all the combination of all the tests that have been done. Our cases in isolation, we currently have 14 in home isolation, 4 in our isolation Government of Guam facilities. And as I mentioned earlier, we do have cases of the travel related and non-travel related. Those that are not travel related is about 169. And we want to emphasize that those with travel history is 22. Again, we remind everyone that we do also have individuals at the quarantine sites. And currently at the Wyndham, we have 100. We have 103, and then we have Santa Fe 144, and at our other area 120. Those that have completed the entire 14-day quarantine in our Government of Guam facilities amounts from the beginning of this whole pandemic, which was on March 19 to the current May 23rd, 782 have completed. And those that have been cleared in terms of the COVID cases, we have 143 as we stand. Please resort to our website at www.dphss.guam.gov, and you'll see all our dashboards, which has the breakdown in regards to the age, sex, ethnicity, also the number of cases in each village, number of individuals that have cleared with COVID cases, and any other information that you would like to see. We have a wealth of information of educational materials that are provided on site. And as the governor had indicated earlier, we are doing all the homeless populations this entire week. And we are also finishing up all the Gura housing areas for our elderly population and going back to all those COVID positive cases, doing our household contacts and close contacts and making sure that they are all tested. Thank you, Governor.
Thank you, Linda. And before we begin the questions, I just wanted to also note and add that one of the reasons we are announcing the future reopening of our tourism effective July 1st is that we wanted our industry to be prepared. And we wanted to signal this to them so that they can begin preparations to, again, bring back our tourism industry. I am informed in the market that it takes anywhere from 30 to 45 days of lead time in order for us to start, again, booking business and visits to Guam. So it will be effective, again, barring any kind of abnormal or increase in surge of positive cases, as Linda was saying, that they will be continuing, and we will be continuing monitoring and doing expanded testing to, again, have a better picture of community spread.
Thank you, Governor. And we'll open up the floor to some questions. And just a reminder again to all our media partners, if we can adhere to the one question and one follow-up, just to be fair to one another. We appreciate all of your cooperation. We'll begin with Mariana's Business Journal, Wayne Chargaloff.
Good day, everyone. This is for the governor. We've heard complaints from various people arriving at the airport that sometimes it seems people are getting quarantined regardless of the criteria, that the criteria to quarantine people seems at least sometimes almost arbitrary. Given that you're relaxing restrictions on arrivals at the airport, when can we expect to see new guidelines for screening people at the airport? And how much flexibility do the screening personnel have to determine whether or not someone should be quarantined?
The guidelines that we have right now, Wayne, are guidelines that we have been using since the day one of our quarantine. There are some protocols that we have improved, and there were some guidelines that we also added. And so we are looking, because of our success in containing the virus, we're looking at relaxing some of that quarantine, and the protocols that we are going to be issuing, the revised protocol or the modified protocol. I am expecting it to be finalized by this weekend and make it effective on Monday. So yes, there is going to be some relaxation. We're probably not going to require testing. And we will most likely adhere to home quarantine for our returning residents. There's still some finite details that has not yet been finalized. But for the most part, that is, I think, the major change in our protocol, that we will allow home self-quarantine with monitoring and with adherence to the requirements if you are home quarantined. There is also going to be some exceptions to restricted activity while you are home quarantined. And we will provide that for the public once we get it again finalized.
Okay, so just to clarify, what some people perceived as deviation from the established policy, that was just the policy evolving over time, is what you're saying?
It's a policy that what?
The policy was evolving over time is that what you're saying?
We had our protocols that we had already accepted and approved. And there were some situations where there were exceptions being made from the policy, but that's under the authority and the direction of the public health director. Because there are some compassionate cases that we had to look at. There's some medical issues that maybe an individual has that might not be most appropriate for government quarantine. So these are some things that, as a result of maybe extenuating circumstances, that exceptions have been made.
Okay, and for my second question, can you say at what percentage occupancy we can expect for the hotels? Like, will there be a limitation on occupancy for them?
For hotels, you mean when we open the hotels, is there going to
Yes.
be a occupancy limitation? I
Yes,
don't
when
think
they open
so.
up.
Yeah, I don't think so, because if they follow social distancing, if they follow the mask with the employees, we should be okay, because hotels have individual rooms and so forth. We may maybe look at congregation maybe for ballrooms and gala events, but for the most part, I don't think we will have any limitations or restrictions on hotel occupancy.
Okay, so, and just to clarify, there won't be a restriction on the hotel occupancy, but there will be other measures implemented to keep people
Absolutely,
safe.
yes.
Okay,
Thank you, Wayne.
thank you.
Next, PNC, Kevin Kerrigan. Hi, Kevin, are you there?
I'm sorry, I just had to turn my mic on. Good afternoon, everyone. This question is for the governor with reference to the reopening of the tourism market. And I'm wondering if you've received any assurances from the governments or tourism officials in South Korea, Taiwan, and Japan about whether those countries will be lifting their own quarantines. And also, have any airlines given you positive assurances that they'll resume flights here?
I think the United Airlines is looking at resuming flights here. As far as the government, I have not really spoken to the government in terms of what their future is in lifting their quarantine. Of course, their travel is going to be, I think, dependent on whether they will continue to quarantine their returning residents. So I have not heard anything. I do know that for Taiwan, they are quarantining foreign travelers, but they're not quarantining returning residents. And we have also this decision, or this relaxing of the restrictions of the tourism, is also in collaboration with medical advice and also with business advice. And I know that GVB is working closely with their market and their contracts in those various markets to again get more advice and information as to how to proceed with this lifting and relaxation of our tourism industry.
Thank you, Governor. For my follow-up question, a separate issue. This morning, as you know, there was quite a line at the Teton baseball field. And I'm wondering if you talk to us about this, what that says, what that long line said about the state of need on island right now, and whether there will be any changes in the distribution points, or whether or not you're going to ask the Guam Guard to help out in the future.
Yes, the long lines, I think, yes, is a evidence, I think, Kevin, of the need for our food for our people, and because it shows the demand. And as far as the supply, in terms of food supply, the food supply is there. As far as the logistics, I think this morning we were very well organized in the logistics. We have stepped in to help our Department of Education run the program, as this program is under the authority of the state agency, which is designated to be the Department of Education. And as a result of our stepping in to help out with our Department of Education, I think we have provided an improved organization and improved support and improved resources to our Department of Education. I think they have done a good job to try and distribute these food to many, 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 many people who are in need. And I think us coming in just makes it much more efficient and much more less inconvenience for our public and our people. And I appreciate the work that they're doing. It's really a big job to do, anywhere from packing the food to organizing the traffic to making the flow a lot faster, to allowing less time in terms of waiting for the lines to go through, in terms of putting the food into the trunk and so forth. So I think we've gotten a good system going, and we will continue that. And we will also, I understand, work with the Department of Education when they identify other sites that they would be using to distribute the food to our vast majority of our people out there.
Governor.
Thank you, Kevin. Next is KOAM, Nestor Lecanto.
Thank you. Good afternoon, Governor Ricky and Linda. Governor, I just wanted to get back to the issue of the July 1st reopening of tourism. Have you had a chance to speak with GVB and former Governor Gutierrez and discuss how they're going to market Guam? What sort of things are they going to highlight, for example, that Guam is relatively safe, that sort of thing?
Yes, actually, I've been in close communication with the team at GVB. And in fact, we just met yesterday and worked through the decision to prepare our industry to open on July 1st based on the importance, Nestor, to make sure that we give them a heads up so that they can prepare. And they are going to be working very closely with their market contacts, and they're going to be looking at how do we attract and again incentivize and persuade the market to come. Of course, they're very mindful of the fact that at the beginning we're not going to have a huge amount of tourists coming in because, again, it is a mindset, right? Oh, is this place safe? We are going to market that Guam is safe, and we are going to market that we continue putting in measures to continue making it a safe place. That's one of the things, especially in light of the fact, Nestor, that with our low numbers in COVID cases, our low fatality of COVID cases, and in fact, in light of the fact that we also were just as aggressive and just as proactive in putting in these measures as South Korea, Japan, and Taiwan did. And as a result, they have been successful in containing the coronavirus also. So we are going to continue using our measures to keep our place safe, and we will be able, I think, to bring back our industry. And also, I'm very appreciative of GVB and the task force that former Governor Gutierrez has put forward in terms of close communication and close marketing so that we can, again, bring our tourists back to Guam.
And the second question, Governor, is are we starting to see a shifting of your focus, your administration's focus on the looming economic crisis, if you will? We've asked several people in the government about, the revenue projections for GovGuam. There's no clear-cut answer on that, but the conventional wisdom is that we're in for a little bit of pain next fiscal year. Can you discuss a little bit about that? What are your What is your visibility in terms of government's revenues and the government's ability to fully operate?
I think we continue to focus, Nestor, on making sure our people are safe and making sure our people are healthy and making sure that we don't increase our fatalities. That's foremost. And we've never really shifted our focus from that. We are very concerned, of course, of our economy. We are very concerned about the potential losses in revenues. We are also very concerned about the losses in jobs and, of course, businesses that are not able to maybe start off rebuild again, but we are making sure that we are helping them in every way we can through financial means, through resources, through training, and so forth. So we are focusing a lot of our effort and a lot of our energies with the help of the business community and with the help of the whole community, actually, with help of financials, to rebuild again our economy. So in terms of revenues, we are going to have some revenue losses. We are looking at, of course, the hotel occupancy and tourist attraction funds to be tremendously decreased from what we have projected. And we are also looking at our collections, not as what we had projected, but I feel with our financial and fiscal discipline that we can move forward to, again, making our economy better and move forward to helping increase the revenues. I think the federal programs that have been set forth, Nestor, is helping. It's putting money back into the hands of our people. And I think it's strengthening and enhancing our consumer buying power. And as a result of that, I don't see a big loss in our revenues. We're looking at, maybe if you look at the CRER, we're looking at the end of this fiscal year to be a negative $4 million. And of course, we'd have to look at the projections for the 2021. And if we can start again stimulating our tourist industry, and not only that, but also diversifying and starting up some other of our economies, we could probably get our economy back in good engine and good mechanism and so forth. Don't forget too, Nestor, that in our economy there are 3 areas that is driven: tourism, government spending, and military spending. And so as far as military spending and government spending, we're still moving ahead with that. We are still providing contracts for vendors. We are still providing services for our people. Military buildup is still on target. Construction is still going on. Construction never really ended. During the pandemic, we kept in the construction industry up and going. And so there are other things in our economy that have been happening. Tourism is the most affected one.
Thank you, Nestor. K57, Patty Arroyo.
Good afternoon, everyone. Dr. Cabrera, how are you? How are you, sir? Are you okay?
Oh, that's Ricky.
Oh, Ricky, I'm
Ricky
sorry.
Hernandez.
Ricky, I thought you said Dr. Cabrera. I wanted to ask about the argument over science versus the government wisdom, and how comfortable is anyone there? Linda, Governor, Ricky, are you with the relaxation of the protocols, and what would your expertise look for? I mean, how do you balance science versus economic concerns? And is current testing representative of what is really out there?
Okay, so I'm going to try to answer this question in the short period of time, but I think we could also go out and have a big discussion about it when we're able to dine in, Patty. So, because I think it's a really big conversation and a long discussion to make. But I think with science and government, we are not doing and relaxing anything without science, of course. And we are monitoring again. We have provided the 4 requirements that we are looking to measure in terms of how comfortable and how assured we are that we could still lift the restrictions and still protect our people's safety and health. And of course, the 4 requirements are how are our contact cases doing? How are our testing capacity? Is our testing capacity capable to make sure that we continue monitoring and diagnosing moving forward? How is our hospital capacity? That is very important, because if people get really, really sick, we want to make sure that we have the resources to provide the treatment and the care for our sick people. And I think the 4th one is, let's see, contact tracing. How are we in terms of investigating and looking at those positive cases, if they are, and how are we at following them, and how are we at making sure we're going out and also looking at who that positive person has made contact with, so we can investigate those contact people and making sure that they're positive or not. And if they're positive, of course, we continue on with our isolation of 14 days. We continue on making sure that that person is not exposed to other people, so we can then arrest the exposure right at that point in time. So government is guided by science, and you're absolutely right about trying to balance out the economy and the health of our people. And in those two very equal interests, the most compelling for me is the health of our people, because we can't really have an economy if we don't have a health of our people. And so we are, I feel very comfortable that what we have done is protecting the health of our people. And now we need to look more to how can we rebuild our economy, so overall there's a balance in that, what continue on with the livelihood of our people.
Thank you, Governor.
Linda wants to add something.
Oh,
Yeah,
sure. Go ahead, Linda.
So in terms of science, we know from the annals of internal medicine that what we're saying is that it is very important that we understand the incubation period of this virus, 2 days to 14 days. We want to make certain that science says within 4, almost 5 days of infection will occur, where the body will have the viral loads for a test that will be revealing that the person is indeed infected. Then you also have science showing, and this is complete science, saying that on average, more than 96% of those infections will occur by the 11.5 day of this incubation period. Having said that, it is very important to reiterate that the reason why we have this quarantine in place is because we want to maintain that those individuals, whether they're quarantining at home or they're quarantining at the government of Guam facilities, that we're able to contain them in an environment that is very restrictive from the other people in our community. And that in itself is going to allow us to identify if these people that are in quarantine indeed become infectious. That's the place or the time frame where they are infectious. It's an incubation period. And so we want to make certain that when they have these symptoms that they arise, they are tested, they're confirmed to be positive, and that any other contacts, whether they're in their home, living with them, or they're in contact with family members or friends that come and visit them a lot, that we also test them. That is key. We want to contain. And that's, I think, what we've done. We've contained this virus. And we want to make sure that if we have identified any clusters, as we have, those 11 clusters that we've identified, we definitely are investigating. We're doing our surveillance, our contact follow-ups to ensure that they are tested. We are controlling that. And this also relates to other issues that are very concerning for us, and in regards to even talking about any places, whether they're group homes for the elderly that are residing all together, or whether they're daycare centers where everyone resides together. We want to make certain that everything is safe, especially for the most vulnerable which is our elderly and our children. I
Thank
hope
you,
that answers-
Linda. It does. Thank you. Thank you very much. The Saipan Tribune today is reporting that, and it's attributed to you, Linda, any traveler, returning resident, or visitor who will be flying to Guam will still have to go under quarantine, even if you have a certificate stating that you have tested negative for COVID-19. With
Yes,
that,
when we say
yeah.
quarantine, you're absolutely right. Quarantine. Now, if they have a testing that was done 72 hours prior to arriving to Guam, then that test has to be a PCR, a polymerase chain reaction test, not an antibody test. There's a difference. Number one. Number two, if they are coming here, that does not exempt them from being quarantined. It only releases them from being quarantined at the Government of Guam facility. However, they still have to be quarantined at home. And in that way, if they are residents of Guam, they continue to be quarantined for that 14-day period, because we don't know where they've been prior to arriving into Guam. We don't know if they've been into other hotspots that we're not aware of. We just had a traveler just the other day, actually this past week, that traveled from Texas, and we caught it in the quarantine facility, in the Government of Guam quarantine facility. And they tested.
How do you police
positive.
that? How do you police that, Linda? How would you, for returning residents that are going back to their
Yes,
homes and they have
right,
to go to a
because
doctor, they have to go to a doctor's appointment. How do you police that?
We
And
police
what
it
are the,
because the minute they arrive into Guam, we have a voluntary agreement that they need to sign. They need to indicate where they're going to be quarantined, whether they're at home or whether they're at the Government of Guam entity. We then have our team, our surveillance team, that will also monitor them at home. And that means they're going to be calling them, or we're implementing a new app, which is IMOCA, that we're going to be able to talk to them. We're going to have to see them through our virtual system, whether it's your Apple device or a smartphone. And we're going to be able to communicate with them. We use the same device for our TB patients that need to take their medication. It's called direct observed therapy, and we're using the same technology to do that. So that's how we're monitoring them. They should be restriction of movement. So we're anticipating that they'll have other family members that will just drop their food. They will be separated from their family, living in their own bedroom, having their own bathroom, and so forth. And so this is the way that we're going to continue doing this. Patty, we've been doing this even before we had test kits. We've been doing this because we had to figure out, how do we handle these cases? It was until that time when we started having 3 cases right after the declaration, we knew that these were all coming from the Philippines. And then not too long after that, we had an additional 2 more cases. So it became obvious during that time, and I appeared at court indicating to the judge that quarantine is very important. It works, and it has worked. And the judge asked me, how many have tested positive? And I indicated to her, we knew about 3 cases. And so she asked me also, would you do any exceptions for quarantining them at the government facility? Because we did have residents and non-residents coming from the Philippines quarantined in the Government of Guam facility. And so I said to the judge, yes, we make exceptions. And the exceptions we've made are especially those patients that just came out of surgery from St. Luke's, that they needed to be in a comfortable environment. And what more comfortable than being at home? And we made those
I'm just saying that, but now we also have, if you will
Thank you,
indulge me, we have Taiwan, we have Japan, and we have Korea that have now been opened up. How is that going to be different than returning residents coming back that have tested negative?
Those people are, those people probably are coming from hotspot areas, Patty, and that's why we are very adamant in self quarantine. So we're not, in our new protocol that's coming out, we're not. We are giving them a choice, actually, either to do government or home quarantine. And that is one of the reasons why I feel comfortable about also lifting restrictions for our tourism, because we're lifting it for those areas that are now not hotspots. They've contained their viruses, and they've even are lifting their health emergencies. So, I think we still have to be very vigilant in making sure that we continue on with some of our measures that can, again, assure and protect that our people's safety is protected.
Thank you, Patty. Next is Point, Nick Delgado.
Today, so my question has to do with testing that we've been conducting these past several weeks and these past couple of months. It's been nearly 3 months since the island was hit with COVID, and yet we're still at just above 5,000 tests that were performed. So my question is, why haven't the tests been as robust as I believe, Governor, you mentioned 200 a day that was previously announced?
It actually is, Nick. We've been averaging, I think, the last couple of weeks about maybe 100, 150, 200 a day. If you add up all the other areas that have tested, if you add GMH, if you add DLS, if you had the clinics, if you added the GRMC and also the Naval Hospital. So we are going to be reporting that in the future, because we are testing more than what public health is testing. The numbers that we are reporting are numbers just from public health, although the positive cases are cases not just specifically from public health, but also from other laboratories and other entities.
Yeah, just
So
to
we
follow
are
up on
doing
that.
a robust testing. I think we've expanded our testing since April 28th. And that is why we're seeing some of these positives coming up, which we expect that it will be. But if you look at the whole picture, we're still below the 3% positivity rate, which is a good indication that we have contained our virus.
Yeah, and in terms of following up with the testing topic, I was wondering, you might have seen the news recently about the South Korean test kits being recently added to the FDA list. I wanted to get your comments to that and where we are in terms of our research to get test kits from South Korea. And also, as you move forward with easing up their travel restrictions, will there be any plans, or where are we at with trying to test at the airport for our arriving passengers?
All right, so the discussions about testing at the airport has been that we probably will not require testing at the airport, but we will require some monitoring and checking at the airport. I also feel that, yes, the SOGEN, I guess, has been added in the EUA for testing, but we already have the supply and the inventory that we need from the CDC, from HHS, from IRR, from other areas that we do, and we do have a supply that is capable and adequate to test our community.
And I just wanted to add that the Department of Public Health also received a $5.6 million to expand its testing capacity through our epidemiology laboratory capacity grant. And the test kits that we are getting is specific for the machines that we currently have. We're also adding on another ABI 7500 through another grant that was provided to us through our Public Health Emergency Preparedness Grant. And so we'll have now 2 PCR ABI 7500 machine on top of our Gene Expert. And also we're moving our ABI 7500, our ABI Abbott Now, ID Now, into the Camille Centers, because the Camille Centers also received $762,000 in their grant specifically to expand the testing capacity at the community health centers. And so having said that, we also have an existing contract with DLS to expand our capacity as well. And so we have brought that to the grants project officer to get approval that we can continue our ability to contract and to be involved with DLS, as well as having all these test kits being paid for through the granting source. And that is the reason why we are sticking through these specific machines that are PCR machines. And the reason, because it's the federal government CDC grants that pay for these test kits.
Thank you, Nick. Pacific Island Times, Johanna Salinas.
Half a day, everyone. Hi.
Half a day, Joanna.
Hi. So my question is related to GPO. So the GPO general manager, he said that several retailers have been waiting to receive their hand sanitizers that public health confiscated back in April. So my question is, why does the AG need an opinion on this issue?
Yeah, we first of all, the confiscation is not at public health. It is with the Guam Customs and Quarantine, and it remains there. We still have not, we're not in possession of it. That's number one, to get the facts straight. Second of all, the Attorney General is involved because we have to follow certain guidelines. And right now we already met with him. And so we're just getting the response, and we're ready to move forward as soon as we get his response. And we're addressing it. Definitely, that's on my top of my priority list. And bear in mind that we're going to do it the right way, because our staff at the Department of Public Health, our FDA, Food and Drug Administration administrators, and we are commissioners for FDA. And we want to make certain that all that we're doing is in confinement, in accordance with the law. Thank you.
Okay. So, will the retailers be reimbursed for the sales that they are losing as a result of these products being held in the warehouse?
No, they won't.
Okay. Thank you.
Thank you, Johanna. Next is I-94, Chris Burnett.
Half a day, everyone. My question is for Linda. Hi, Linda.
Hi.
Can you clarify what was the problem with Hotel Santa Fe? Because we're hearing that it didn't meet standards. We've tried to get a hold of the chief procurement officer who oversees the procurement for the government of Guam normally, Claudia Faji. However, we haven't got a response. We heard there were issues with it though, and we know that people quarantined there were moved to another facility. So I guess my questions are, how is that possible if you guys conduct a walkthrough prior to signing anything? And is that contract still in effect? And is anyone going to be held accountable for that?
I'm going to just say that I don't handle the procurement of the facilities for those isolation or quarantine. Our role at the department is just to look at the facility and ensure that there is some type of negative air pressure, ensure that there's containment for infection control and so forth. And that's our role in regards to what we're doing at our the department. So I will diverge that question to perhaps the governor. Maybe she can elaborate more on that.
It's a matter of having a contract, and services that are to be delivered are delivered. And so there was I guess not not adherence, but the services that they said that was going to happen didn't happen. And so it was to the point where we wanted to make sure that our people are, in a much better facility.
Okay, thank you, Governor. Linda, we saw in your the public health situation report, it says that 2 people who tested positive are at an unknown isolation, or it says their location for isolation is unknown. What, can you clarify that? Are they homeless? And
I'm not
if
certain who the 2 you're talking about. If you're talking about the last 2 that we tested yesterday, they're contacts from the 11 positive cases that we had in the residential cluster.
And so it says
is that the one you're talking about?
I'm
Or is
sorry,
it
Linda, I'm talking about the one on the situation report that says, location for
report?
isolation unknown. And there are 2 positive
Oh,
patients.
it's pending. They're still investigating, perhaps. When it says unknown, it's under investigation, and then after the investigation is complete, then we categorize them where they're going to be.
So we don't know where they're isolating as COVID-19 positives right now?
No, what I'm saying is if we identify where they're going to be, we have to investigate whether the home is conducive for home isolation. In other words, will there be other family members in that home that could have other members that may have comorbid conditions? Or are there any conditions in the household that they cannot share rooms, or there's so many people living in that same household?
So
Once
do you
that is
know,
determined, then they will, the staff will say, well, I don't think your home is conducive, so we need to put you in the GovCom isolation facility.
so you know where they're
To
at
answer
right
your
now?
question. Yeah, well, we're gonna find out, and we'll get back to you. I promise you, once we get that addressed.
So
Thank you,
we have
Chris.
2 COVID.
Thank you.
Hello?
Thank you, Chris.
Hi, hello.
Yeah, go ahead, Chris.
Oh, sorry. Yeah, because I know Patty got a couple extra questions, so I wanted to get one more in, if that's okay. Can you give us an update on the Hardin homeless shelter? Because, we were all in on Paseo and that got scrapped, and we haven't really heard anything. And I know the Homeless Coalition, especially since we're testing the homeless this week, they're kind of grumbling about it. So could you
Yes,
please
the
respond?
Homeless Coalition, Chris has been working with us, and we've issued the RFP out for these hardened places, and we're just in the process, I think, of reviewing the RFP interests that have come back.
Do you have a timeline, Governor?
Well, as soon as the procurement officer reviews it, and then certainly once it's awarded, we'll move forward with it very quickly.
Okay, thank you.
Thank you, Chris. Guam Daily Post, Heidi Eugenio.
Good afternoon, Governor.
Good afternoon.
Governor, will you extend your public health state of emergency, which is expiring May 30? And what does an extension mean to residents, businesses, and also the eviction moratorium?
So really the expiration of this public health emergency is on June 5th, not May 31st. And so we are looking at possibly extending it, because we are, in order for us to, again, react to the community and react to the urgency, we need to be still under the public health emergency. What that means is we are able to continue on with our measures and be able to, as we move from PCOR 2 to PCOR 3, and measures are still in place, and as we slowly lift the restrictions, we cannot be able to do it without a public health emergency. And as we continue on with the measures and the restrictions, we have to be in a public health emergency situation. Additionally, also for financial and FEMA help.
Governor, that's another, I'm sorry, is that for another 30 days?
My authority for public health emergency is 30 days. Correct.
So, so if it's extended 30 days, it would expire July 5th.
Probably, yeah. Yeah.
Governor, what about on the moratorium on
We'll
eviction?
continue the eviction moratorium as long as we are in public health emergency.
Okay. My second question, in April, you said the application period for workers to access federal unemployment benefits will begin in May. Has the Guam Department of Labor given you a launch date for the application? And are you satisfied with labor's pace, and how could the department improve?
Yes, I am familiar with the process and the progress there with the pandemic unemployment benefits. And you have to remember, Heidi, that the U.S. has a history of 80 years of 80 years of unemployment insurance. We have not had any unemployment insurance infrastructure here or any kind of unemployment program. So what really has been happening these last month and a half is we are creating a unemployment insurance infrastructure, and we're doing it very quickly in a matter of 2 months, what the United States has done for over 80 years. And I think that's a big, tall order to meet. And I'm very impressed with the team of Dave De La Sola in making that happen. I do know that right now, the end part, the last piece in this whole technology that we're using is the online application. And I know that they're testing it right now as we speak, and they're identifying, glitches, and they're correcting those glitches. I think he'll be making an announcement soon as to when that online application will happen. Once that happens, people can apply and they'll get approval, and then their checks will be issued.
Do you know, Governor, if that's going to happen in May or not until early June?
That's going to probably happen this weekend.
Thank you.
Barring any kind of, serious or big complications that we can't deal with right away. So it is going to happen. We're looking at this weekend.
Thank you.
You're welcome.
Thank you, Heidi. PDN, Anamita Kaur.
Good afternoon, everyone. Governor, so given that visitors from South Korea, Japan, Taiwan will no longer be subject to the 14-day quarantine, what measures will be in place at the airport to ensure that incoming passengers are not carrying the virus? And what measures will there be beyond that to monitor tourists, given that they'll be in hotels and Airbnbs throughout the community to ensure, control of the virus?
So we're still working out those details, and once it's final, we'll of course, like I said earlier in my statement, provide it. But even without the tourists, we're still going to be monitoring people that are coming in. We're going to be doing thermal scanning. We're going to be, they're going to be asked questions. Where have you traveled? Have you had any symptoms? And so forth. And again, I just want to make people repeat it again, that the biggest preventive measure is wearing your mask and social distancing. And that will continue on with the hotel workers, also other employees that work in the hotel industry and the tourist industry.
All right, thank you, Governor. And this is for Linda. In last night's Joint Information Center release, it stated that Public Health had recently changed their criteria in regards to who can be released from isolation. Can you explain what informed this change in criteria and why it was done?
Well, we haven't implemented any changes yet until this memo comes out. And again, this memo is going to be coming out on Monday. And so I don't know what source of information that, I hope I'm answering the question, but in this particular executive guidance that we're going to give out will be the one that we're going to issue on Monday.
In last night's JIC release at 8:30 p.m., it said that new criteria for release of cases from isolation were implemented on May 22nd for persons having symptoms at least 10 days have passed since recovery, defined as resolution, et cetera.
Yes. I see what you're saying. What we are saying is something totally different. So now I understand your question. Your question is, in the past, when we had patients that were positive and they were in isolation, whether they're in home or in quarantine, CDC's guidelines, and again, CDC's guidelines constantly change. During that time, CDC's guidelines is that if they are positive, and they're now ready to be cleared, they have to have symptom-free for the first 72 hours and 1 week without symptoms from the date of the first symptom began. So what that means is that if they are symptom-free, and let's say on day 1, they had no symptoms, day 2, they had no symptoms, day 3, they started having symptoms, then day 4, you have to count another week from the first day, which is day 3. So you go day 3, you count 7 days, 3, 4, 5, 6, 7, 8, 9. Then day 9, they're still symptom-free, then they're cleared. And that's what CDC's policy has been. Now, what happened was we were clearing them, and we noticed that some of these individuals that tested positive continue to exhibit more symptoms. Then what we had to do is implement a previous CDC guideline that said, okay, we have 2 tests that will be done, and those 2 tests will be negative. So even if the person tested positive, we'll test them again. And if they tested negative, then for certain, before we release them, we want to give them another test. And if we do get that test done and it is negative, so 2 negative tests, then we can say they're cleared. Okay, I hope that answers your question.
Right, thank you.
Thank you, Anamita. And Governor, closing remarks.
I just wanted to make a little a correction on the expiration of the public health emergency. It expires on May 30th. The reason I said June 5th is the previous one expired on May 5th. However, we issued another one on April 30th, and that's why May 30th is the date of expiration. I just also wanted to, again, express my appreciation and my gratefulness for our community and following our directives. I am very encouraged by what I am seeing in the data that we have been looking at the last 3-4 weeks. I expect it to continue in terms of the low positivity rates and the number of cases. However, I still also expect to see positive cases, but I think we are still going to be below what is indicated in terms of evidencing that we are containing our coronavirus. I also am very encouraged by the fact that we are looking at reopening our tourism. And I think as we move forward in that path, we also need to be much more even vigilant and committed in making sure that we do preventive measures. Again, using your mask in public, social distancing, washing your hands, sanitizing, and so forth, because as simple as it seems, and maybe as basic as it seems, that is really what is helping us to contain this virus. And so I again urge and ask you for your help, and also ask you for your support as we all get together to, again, fight this virus that really has caused a lot of abnormality in our community, and hoping that we go back to as normal as we can be in the near future. So thank you again, and for your